Hi everyone, and welcome to A&P with Dr. O. In our video here, we are going to be taking a look within the cranial cavity, and we're going to focus mainly on the sphenoid and ethmoid bones, although we will look at some structures that are associated with some of our other bones of the skull as well. Let's go ahead though and start with the sphenoid and ethmoid bone. Part of the ethmoid bone is embedded in the skull, so we can't see the entire thing. We did see the perpendicular plate when we were looking at the nasal cavity. Remember, we weren't able to see the superior nasal conchae because they are embedded in the skull, but we can see this portion here that kind of rises up in a superior fashion into this cranial cavity. And sometimes the analogy that's used is an iceberg for the ethmoid bone, because you can only, from this view, see the top of the iceberg. Some use the analogy that this piece right here looks like a shark fin. Any analogy that you want to use, I think, is great to help you remember these bones and bone markings. What we can see of the ethmoid bone in this view is we can see, again, this portion that sticks up, which would be our shark fin or tip of the iceberg, whatever analogy you want to use. And this part that sticks up is known as the cristagalli. Now that means cock's comb. Anatomists thought that this structure looked like rooster feathers. That's then how it got its name. Surrounding the cristagalli is the cribriform plate. That's what we can see surrounding it. It's going to contain small openings for the passage of olfactory nerves. Again, that's what we can see in terms of the ethmoid bone in this view. We can also see parts of the sphenoid bone. We already looked at the superior and inferior orbital fissures, but now we're going to see some of the other structures. The sphenoid bone, I do have some pipe cleaners in because they're going to be relevant to the foramen that we're going to be looking at, but I did leave this side free. The sphenoid bone and the ethmoid bone together, I think, resemble a bat. And that's helpful because the sphenoid bone has greater wings and lesser wings. The small one up top is a lesser wing, and then down here we have a greater wing. We would have the same thing on the other side as well. I know it's a little bit obscured by the pipe cleaners, but there would be a lesser wing on this side. And then if I, move our pipe cleaners a little bit, you can see that there is a greater wing there as well. We also have this indentation here where I'm putting my pointer that is known as the sella turcica, which means Turkish saddle. And I find that to be helpful in remembering that structure, because I've created a little story that goes with our ethmoid bone and sphenoid bone and some of these foramen that we are going to be taking a look at. And I base this story in part on what I learned as a student and what I've read in anatomy texts and lab books and things of that nature. So this is the story I developed based on tips that I learned and read from various other sources. I like to think about, again, the sphenoid and ethmoid bone being a bat. The ethmoid bone makes up the head of the bat with the cristagalli and cribriform plate. The sphenoid bone is the wings, the lesser wings and the greater wings. We're also going to see that the bat has legs, and we'll see that when we look at the inferior view of the skull. And then I also like to think that because the bat has a saddle, that we are going to have a cowboy that is going to ride on the bat. Because when a cowboy rides a horse, he needs a saddle. So when he's riding the bat in our little story here, he needs a saddle to sit on, which is the sella turcica. When a cowboy rides a horse, he needs to put his feet in the stirrups, and he needs to be able to have reins. That way he can control the horse. We're going to have the same thing with our bat. We are going to need to have a place for our reins. So we can see this pipe cleaner here is going through an opening near the lesser wing. We can see that opening on the other side right here as well. And those openings are known as the optic foramen, or sometimes they are called the optic canal. And if we turn the skull, we can actually see that the pipe cleaner is coming out through the orbit of the eye. Remember, foramen is a rounded passageway for blood vessels and nerves. In this case, because it's the optic canal or optic foramen, it's going to be a passageway for the optic nerve. Those are going to be the reins in our analogy. Now, we also need to have stirrups, or a place for the cowboy to put his feet. And we have openings. We have foramen on either side of the saddle. So there's one over here as well. And then there's one right here. If I pull up this pipe cleaner, so one right here. And those on either side of the saddle are known as the foramen lacerum. Now the cowboy's name is Ross, R-O-S. That's a mnemonic device for the other openings. The first one is round. It is therefore called the foramen rotundum. That would be the R in our Ross. The next one is oval in shape, and it's called the foramen ovale. That would be the O in our Ross. And then the last one, the smallest one at the end, that is going to be the foramen spinosum, and spinosum means spiny. We can see them on the other side as well. And if I have the model turned, we can see the round opening here. That's going to be the foramen rotundum. We can see the oval opening here. That's going to be the foramen ovale. And then we can see the little tiny spiny one right here. And that's going to be the foramen spinosum. Now we have some other openings that we want to go ahead and discuss, and a few other structures as well. If we go back to the temporal bone, now we can see the carotid canal associated with the temporal bone, and we can see it on either side here. So each of those is going to be a carotid canal. That's going to be an opening for the internal carotid artery. And we also can see another foramen here. This is going to be the jugular foramen. We can see it on this side as well. Looks kind of like a kidney bean. Some people have said it looks like a heart, or the Nike swoosh symbol. Those are some different ways that students have remembered that jugular foramen. And it's going to provide an opening for the jugular vein. We also have this very large foramen here, and this is going to be the foramen magnum. Magnum means large, and that's how this foramen then gets its name. One more thing I want to point out that's associated with the temporal bone is this internal acoustic meatus here. We talked about the external acoustic meatus earlier. Here's our internal acoustic meatus. Just to get your bearings, it's near this carotid canal and above this jugular foramen here. If you find the jugular foramen, then go up, and then you can see that internal acoustic meatus.